prostate cancer is so common. Like most men die probably with some prostate cancer.
Even though they may not know it.
Right.
Yeah.
But what's really interesting is that the studies that came out on androgens and testosterone were done a long time ago. They were done in the 40s, and they were done by a physician who had been testing testosterone with different conditions and stuff. He actually won the Nobel Prize. I can't remember. I think the androgen receptor, he had something to do. I can't exactly remember what he won the Nobel Prize for.
Yeah.
But he did a study, wrote a paper on, there was one patient, an N of 1. I don't even know how this got through because this is not statistically significant at all. But there was an N of 1 of a man who had taken testosterone therapy and his prostate cancer got worse. Okay. So this study from the 1940s is what physicians used for decades to tell men that testosterone therapy was dangerous and could cause prostate cancer.
There you go.
But today in urology, in the modern medical world of men's health, we actually know that that prostate cancer is likely being caused by low testosterone.
And by elevated estradiol.
And by these elevated estrogens. So again, if you go back, excess body fat, insulin resistance, inflammation, which is going to drive aromatase activity.
That's right.
And now you have excess estrogen.
Yeah.
That is what's driving it. And so even sex hormone binding globulin, which is a protein that binds up most of your testosterone.
Correct.
Sex hormone binding globulin will be affected as well by that affects how much testosterone you bind up, etc. And they know that prostate cancer in general. Oh, and PSA. Sorry. So PSA is a blood marker.
Prostate-specific antigen.
Yes. And it's a blood marker now that we can actually test the inflammation of the prostate without doing a prostate exam.
Correct.
We know that stimulating the prostate too much can cause problems, right? And you have to feel a lot of prostates to actually know. So I'm not a urologist. I don't specialize just in men's health. I'm not doing prostate exams all day long. So if I have a man who comes in and his PSA is elevated, which would just say in the blood he's got this antigen that's showing there's some sort of inflammation to the prostate, whether it's BPH or a cancer, I refer them to the urologist.
Okay.
And then the urologist is either going to do a prostate exam or they're going to do a biopsy. And they're going to see, like, is this cancer, is this BPH, whatnot. Right. But we know any stimulation to the prostate can increase PSA. We know riding a motorcycle, riding your bike every day to work, having sex, riding a horse, these can all increase PSA. So we have to be very careful with men when we do labs. I have to say, please do not have sex for 2 days before your prostate, your PSA test.
Okay.
Do not ride your motorcycle all weekend. If you ride horses, don't ride your horse for 2 days.
Right.
Because it stimulates the prostate and it could increase it. And then, there's nothing worse than getting a guy that's got a PSA over 4 and now you have to send him to the urologist. And so we try to diminish those factors. But we do know that PSA will be falsely low when you have low testosterone. And this is a complication too. So you could get the guy's hormones back. It says testosterone's low or it's in the normal range, but it's like normal low, let's say, and their PSA is low. So you go, oh, your prostate's great. But then let's say you do hormone therapy with them and all of a sudden their PSA goes up. Now it may not go over 4, which would be medically indicative of needs to be checked out. But let's say it goes from 0.2 to like 2.5.
You bet. That's a big change.
And then you're like, oh, what's happening? Yeah. Well, that's normal because their testosterone was low, which was falsely elevating or lowering their PSA. So their PSA is maybe going to go up a little bit and that's okay. But it should level out and it should be good. Now, if you've got actual like PSA that's going up, or you give him testosterone therapy and you see him jump, this is why we run labs. This is why we keep track of the guy. Oh, okay, something's going on here and we need to have this checked out. So that's very interesting when it comes to prostate cancer. And I can tell you just from clinical experience in the last 6 years of seeing hundreds of men is like testosterone deficiency is becoming rampant.
Yeah.
And I see guys in their 20s that have lower testosterone, I've got some patients in their 70s and 80s who have higher testosterone.
Yeah.
So why would that be? Well, I think that's because the men today, or that have been born in the last 3 to 4 decades, in the last 2 decades for sure, they were exposed to high levels of toxins and estrogen-like substances in utero.